What's up, future nurses? Welcome to my channel. Today we are going deep dive into Angina Pectoris. We are covering everything from the different type of chest pain to the life-saving MONA protocol, all the way to the big procedure like PTCA and the CABG. This is a mega review, so I have broken it down into the clear section. Feel free to use timestamps in the description to jump to what you need. Let's master this together. First, the foundation. Angina pectoris is essentially chest pain due to reduced blood flow or ischemia to the heart muscle. The root cause is almost always coronary artery disease, where the artery is clogged, limiting oxygen supply. There is a difference between the type of angina. First one, stable angina. This is predictable one, triggered by exertion or stress, relieved by rest or nitroglycerin. It follows a pattern. Second type, unstable angina. This is a medical emergency. It occurs at rest or with a minimal effort. It is not relieved by rest or meds. Think of this as a pre-infarction state, a huge risk for a full-blown heart attack. We also know Prinzmetals or variant angina. This one is unique. It is caused by coronary artery spasm, not just a clog. It often affects young women, typically at night, like 3 or 4 am. The key EKG finding is ST elevation. And for symptoms, think beyond just chest pain. Chest pressure or tightness, pain radiating to the arm, jaw or shoulder, shortness of breath, sweating or, as we charted, diaphoresis, nausea and dizziness. So let's talk about diagnosis and the MONA emergency protocol. So how do we diagnose this? The tests are straightforward. Stress test, EKG, look for T-wave inversion and ST depression, echocardiogram, chest X-ray for cardiomegaly. One of the key points, cardiac enzymes are usually normal in angina. If the cardiac enzyme elevated, think heart attack or myocardial infarction. Now let's talk about the emergency response. Remember the mnemonic MONA for managing acute angina or myocardial infarction in the initial phases. So MONA is quite simple. M is a morphine for pain and anxiety relief. O, oxygen, but only if the patient is hypoxic. N, nitroglycerin sublingual to vasodilate and relieve pain. A, aspirin, Antiplatelet to prevent further clotting. Let's talk about immediate nursing priority. First, rest the patient to reduce cardiac workload. Administer nitroglycerin as ordered. Monitor vital and EKG continuously. Educate patient. If pain lasts longer than 20 minutes, it is an emergency. Seek help immediately. Now we're going to talk about procedures. Once we stabilize the patient, we need to see what's going on and fix it. Coronary angiography. Purpose to find the blockage. A catheter is treated into an artery, contrast dye is injected, and X-ray show the problem. Nursing care is crucial here. Pre-procedure, nothing perose, check for iodine, shellfish allergy, assess renal function like BUN and creatinine, hold metformin and get consent. Post-procedure, this is a big one. Monitor for insertion site, check for bleeding or hematoma, keep the leg straight for 6 hours if femoral approach. Do not let the patient get up, use a bedpan for restroom. Encourage fluid to flush the nephrotoxic contrast dye. Check vitals, pulse and sensation frequently. Notify doctor immediately for bleeding, loss of pulse or return of chest pain. Next procedure is percutaneous transluminal coronary angioplasty, or if short, balloon angioplasty. This is a minimally invasive procedure. They use a balloon to squish the blockage and often place a stent to keep the artery open. PTCA is usually for single vessel disease. Nursing care is very similar to post-angiography. Next procedure is a CABG, or coronary artery bypass graft. This is a hard one. This is open heart surgery. They take a vessel from another part of body, like the saphenous vein in the leg, and create a detour around the blockage. CABG is for multivessel or severe disease. Post-operative nursing care is ICU monitoring, manage chest tube, ventilator and pain, use incentive spirometer to prevent pneumonia, watch for complications like infection, arrhythmias, especially atrial fibrillation, and graft occlusion. Let's quick discuss about difference between PTCA and CABG. Percutaneous transluminal coronary angioplasty is minimally invasive, single vessel, shorter recovery, local anesthesia. And coronary artery bypass graft is open heart surgery, multi-vessel, longer recovery, general anesthesia. Alright, let's get into the drugs. You need to know this inside and out. Nitrates or nitroglycerin. It is actioned like vasodilator, decrease preload and afterload, and elevated oxygen delivery. Everyone need to know about nitroglycerin. Never mix with PD5 inhibitor like Viagra, because it's both straight vasodilator. It can cause severe hypertension, and you also need to remember it is light sensitive and you're supposed to store it in the dark bottle. Next medication is beta blockers, also known as LOL drugs. Action is decrease heart rate and decrease myocardial oxygen demand. Key side effect of beta blockers, they can mask hypoglycemia, can worsen asthma and COPD, and may rise lipids. So beta blockers is lipid unfriendly. Next medication is calcium channel blockers. Calcium channel blockers action is relax vessel, lower blood pressure, decrease workload, especially good for Prinzmetal angina. Aspirin and antiplatelets action prevent clotting. Also good thing to remember, use clopidogrel Plavix if allergic to aspirin. Next is anticoagulants like heparin, warfarin and direct oral anticoagulants. This is thinner for your blood. Good thing to know, you're supposed to watch for bleeding. Quick tip for warfarin: monitor ENR and avoid leafy greens because of vitamin K. Next is statins like atorvastatin and simvastatin. They lower LDL and stabilize plaque to prevent myocardial infarction. For statins, good things to know, you're supposed to watch for rhabdomyolysis, muscle pain and weakness. Monitor liver function test, avoid grapefruit juice. Fun facts: atorvastatin can be taken anytime, but simvastatin is best for bedtime. Other cholesterol lower meds like niacin or vitamin B3 lowers LDL and triglycerides but cause flushing. Fibrates like gemfibrozil great for triglycerides, used with statins cautiously because of rhabdomyolysis. And also bile acid sequestrants can cause GI issue. And never forget lifestyle modifications. Diet, exercise and smoking cessation are always first line. And that's it. A comprehensive review of angina pectoris. We covered type of angina, mono emergency protocol, key procedure like angiography, PTCA and the CABG, and the entire pharmacology lineup. This is a lot, but you are capable of mastering it. Let me know in the comment, do you have a cool mnemonic for remembering the side effect of beta blockers? If this video helped you, please give it a like and subscribe for more. Hit the bell so you don't miss the next. I think next one is heart failure. Thanks for watching and be healthy. You have got this.